for all.
Thank you. Have a seat. Roll call.
Mays. Nikki Brown. Sarah Brown.
Here.
Paul Wellenberger.
Here.
Bradford.
Here.
Robertson.
Here.
Page.
Here.
Lemmings.
Here.
Bass.
Thank you. On agenda items, I would entertain a motion to dispense with the audible reading of the transfers.
So moved.
Second.
Motion and second to dispense with the audible reading of the transfers. Any other discussion or changes to the agenda? Roll call vote with the one change to dispense with the audible reading of transfers.
Mays.
Yes.
Sarah.
Yes.
Paul.
Yes.
Bradford.
Yes.
Robertson.
Yes.
Page.
Yes.
Lemmings.
Yes.
Bass.
Yes.
Thank you. Entertain a motion to approve the minutes and financials.
So moved.
Second.
We have a motion and a second to approve the minutes and financials. Any discussion? All in favor of approval signify by saying aye.
Aye.
Any opposed? Next is county judge's comments. I don't have any, but you guys wanted to speak to our benefits team, and they're here. So if y'all want to make your way up to the microphone, if you have any questions for them, or
Good evening.
they're here for open discussion.
Hey guys, how are y'all?
Good.
Y'all so quiet tonight.
Well, I know there for a little bit, we had problems with employees reaching out saying that they were being told that whatever office they were in wasn't in the network. But I haven't heard of that recently. Is anybody else? It's been a few weeks since I've heard anything, but there for a while, that was a big issue.
Baptist going out of network, is that what that was?
I think one of them, was it Baptist? Yeah.
Yeah.
Yes, so Baptist, and this happens with all of the carriers from time to time. So hospitals are generally speaking on a 3-year contract with insurance companies. It can be longer, it can be up to 5 years, but most of the time they fight for a 3-year contract. And so for those 3 years, they're stuck in whatever contract they agreed to with the insurance carrier. And then when that 3 years comes up, they start fighting for more money. And so they all want more money. And so what Baptist did this time around was they asked to increase their prices and at the same exact time decrease their PPO discount amount. So they were going to get double paid. And the network fought back and said, absolutely not. That's only going to hurt the member. So what you're asking an employee to do is pay twice as much for an MRI and get less of a PPO discount than they got last year. We're not going to go for that. Let's negotiate. And Baptist said, we are not going to negotiate. That's our final answer. And so I'm going to tell y'all this. Y'all are self-funded. You're allowed to choose whoever you want to go to. And if the plan, being you guys, decides that you want to pay it at the in-network rate, you can do that. But Baptist isn't going to give you a PPO discount for it. And they're not going to, and they've raised the rate. So I wouldn't suggest doing that for your members. I would suggest sending them to a provider that cares enough about them to keep their rates at a reasonable level. Because that is what Aetna did for you guys, is they fought for you and said, we're not going to do that to our members. It doesn't hurt us as Aetna, it hurts the member that you're impacting. And that's not okay. And they tried to negotiate. They tried to say, well, we can do maybe a less PPO discount, but not the price increase, or we can do the price increase, but not the PPO discount change. And the hospital wasn't willing to work with them or compromise, and just basically stopped returning the calls. So they're out of network until it hurts them enough that they sign to get back in network.
We usually see, when we see this, we typically see that them end up working it out, whether that's 3 months, 6 months.
Mm-hmm.
You usually see a contract get worked out. So they're probably still negotiating. So,
One of the other Baptists in Arkansas just recently did that with Blue Cross not too many months ago. They were out of network for a few months, and then it hurt their bottom line enough that they came back and actually decided to sit down and negotiate. They did it with United Healthcare about a year ago, ended up getting back in network, negotiating. So sometimes they just have to not get their way for a little while to realize that they can't just go around jacking their prices up for everybody.
You know, UHC and Chi St. Vincent down in that same thing. It's going to happen, and it's going to continue to happen, just because they both don't want to agree. One don't want to give in, the other don't want to give in. So they're always going to fight it out until eventually, at some point, they quit butting heads and say, "Okay, we'll come to an agreement." But in the interim, I think Michelle said it best. In the interim, the people that you have to look out for the most is your employees. It's the people that are utilizing the plan. And they can't put them into a position where they go somewhere and they have to pay exorbitant amount of money for something because somebody can't agree, to a discount. So those discounts are important. They're contractual. They have to work through them. But there's a lot of greed in this ultimately.
How do our employees know what's going on?
So the insurance company and the provider both send out communications to the employees that utilize their facility to let them know that. Some employees read their mail, some don't, but they do send them out. And then there is a continuation of care. So if there is somebody that has a chronic ongoing condition, they can apply for continuation of care, and it allows them to continue in their current treatment path while they help them find an in-network provider that can provide the same service. So it's not just cutting somebody off that might be in the middle of a cancer treatment or something like that.
Dale, what about if one of the departments, the assessor or one of them have a question? Can they ask?
Absolutely.
Absolutely.
Either one of you have questions about the insurance company?
I do have one.
Would you care to come to the microphone so we can get it on camera for full transparency?
Whenever we first talked to you, it was stated that, like, if someone needed an MRI, that you had a clinic that they may go to where they wouldn't even have to pay the deductible. And my employees have not been able to get that done.
Have they contacted the KISS-X program and because we've had employees here use it. I don't know which department they're in. HIPAA law doesn't tell me that,
Right.
but I know that we've had employees that have used it.
They finally gave up, honestly.
Okay, have they called our office?
Yes, they have.
Okay.
Had a lot of trouble.
I haven't heard anything about it. And I've had employees call me, but none of them have mentioned that.
Okay,
So I can look into it and I can get an answer back for you.
okay.
Okay, and what is your
Because
name?
Emma Smiley, the assessor.
Okay.
Yeah. No, they have to have some testing done, I think, every year. And they tried to go ahead and get it scheduled. And another thing that they had trouble with is to try to find out because some people really won't go have anything done if they don't have the money. So they try to get pre-approval and find out what the money is. They cannot get that done. They said you have to have a code. Well, they don't. It's
Correct. So an insurance company has to know what procedure is happening in order
they told
to tell
them the
you.
procedure, not the code.
But one procedure might have 10 codes. So it depends on which code that doctor is using. So the better answer for that member is to call their doctor, because that doctor knows which code they're going to use, and that doctor knows what their contract is with the insurance, so they can tell that member exactly how much that procedure is going to cost.
And they never did get an answer.
Okay,
Yeah.
I can help call their doctor for them, but their doctor would have that information. The insurance company would only have it if they had the medical code. And so what some doctors will do, and dentists do this too, is they send in what's called a predetermination of benefits, where they send in, hey, this is what we want to do to the member. It gives the diagnosis code, it gives the CPT codes of what they expect to do, and the insurance company comes back and says, yes, that is covered underneath the plan, it would be approved, it would apply to the member's deductible, or it would apply to this copay based on the facility that they're having it at. And at this time, of course, depending on when the member has the procedure scheduled, this could change. At this time, the member has met X number of dollars of their deductible. But the insurance, I can't just call and say, I'm having an MRI. There's thousands of different types of MRIs, with contrast, without contrast, of your head, of your arm, and so there's all these different codes that apply to each one of those. And there's different little modifiers, not to get into great detail, but CMS guidelines dictates that, Centers for Medicare. So they would have to know that in order to pull up that specific procedure and tell them whether or not it was covered underneath the plan and what it would cost.
I think they felt like they did do that, and it.
So they had the code and they still couldn't tell them
No,
what it would cost?
They gave it.
Let me give you mine.
They need to contact. They can
Yeah, they
always
need to
contact me
contact
and I can get involved.
You give me some numbers and I'll pass them on.
That's very easy to do.
There you
I
go.
can guarantee.
Thank you.
I'll give you one of my cards as well, so.
That'll work.
We will put you in front of the right people.
Okay.
Yes,
Thank
get the questions answered.
And my cell phone number is on that, so if they need to call me after hours, they can do that too. Okay.
It's been a long time since we've discussed all of this stuff. I guess over a year. Where are we in terms of the bottom line from where we were previous to switching to this company versus now?
Misty?
We passed out a form, the final numbers for 2025. And we're not even sure if all the claims have come in, but as of what has come in as of to date, we've got more than 5,000 in the account, but if you want to look at it as a whole of what we paid and what we paid for our premiums and what we paid out for our claims, we would have just ended with 5,000 for 2025.
What was the premium that we were paying with the other company?
You would have to ask Pam, I don't know.
It was $811.88, I think, with the other company.
So we're
per person every month.
Are we better off now than we were then is my ultimate question.
Lee?
I mean, that would be a Misty question. She's the one that has a,
Well, that is what we have, and one of my main questions I was gonna come up and ask, we were told that, if we went in the hole, we had insurance to cover it. Okay, but my question is, when I talked to you, earlier, my understanding was if we had to go into that money, like if we had a $20,000 claim and we didn't have it and the insurance covered it, my understanding, we had to pay that money back, is that correct?
If it's just an overdraft protection type thing where it's 1 month that it's your claims and it's gone over, yes. They would take it out of the next month's claims pool. If it's over a spec amount, which you did have you had 9 large claimants this past year, 4 of which were extremely high. So I'd have, and I only had through December, so I'm waiting to see if they did go over spec in their run out. You would get reimbursed for that. You would not owe that money back. That would be something that's reimbursable.
Do you know what that amount is?
It's $60,000 per member. So if one person, the whole reason for the specific reinsurance is what it's called. We call it SPEC for short. Specific reinsurance is one of the protections involved in your plan, and it just means that one member cannot wipe out your claims fund, right? So, for instance, I had in another county here in Arkansas, I had a young man that during COVID got very, very sick, went into the hospital, and he had over $1 million in claims. Well, if all of that could come out of your claims fund, it would obviously wipe out your claims fund and then some. And so what specific reinsurance does is it says not one person on the plan can take out more than X number of dollars from your claims fund in a year. And once they exceed that amount, then the stop loss reinsurance picks up and pays whatever the amount is above and beyond that with no limit. Okay. For you guys, and then it's set at a different number for everybody, for every employer group that's self-funded. So for you guys, it's $60,000 because of your size. So I have other groups that might be $120,000 or $150,000 per person, but yours is set at $60,000. And again, that's most of your employees aren't ever going to even have $5,000 in claims in a year, right? Some people didn't use it at all. all year. But then you do have a couple of members that would, somebody has a heart attack or a stroke, somebody has cancer, somebody has renal failure, something like that, then you're going to have a spec claimant. And that's just somebody that exceeds that 60%. And so if somebody does that, then the reinsurer picks up and pays all of those claims for you.
Okay, so, but my question is, if this would have hit 0, are we looking at paying that out of like our reserve money if someone didn't go over that 60,000? Like if we could not claim that or
Yes.
get that refunded?
The reserve money, yes. So the total liability amount is your estimated expected claims plus that 25% corridor cushion, which is the reserve, that the Department of Labor, Department of Insurance in the state of Arkansas says that you have to have in there. Yes, and that is to fund claims. If you exceed the amount that they ask you to put into your claims fund, which includes that risk corridor, then you have aggregate reinsurance, which is specific as one individual person. Aggregate is the group as a whole. If the group as a whole goes over that claims fund amount, you have aggregate reinsurance to pay those claims.
Yeah, but maybe I'm misunderstanding this. What I'm saying is if we don't have one claim that's that amount of money and we still go in the hole, we're going to have to pay that extra money back. Like if we get the insurance, let's say 40,000, but it's over the whole group. It's not just one individual. Us as a county, are we required to pay that money back?
Let me just clarify, do
Okay.
you mean for that specific month, not for the year as a whole, or do you mean for the year as a whole?
Just if we go in the negative at all.
Okay, so yes, you have monthly aggregate accommodation. So if, let's say, the very first month that y'all had claims come out, which wasn't until March, right? Because January and February, the plan was still being set up and people were going to the doctor, but it takes the doctor so many weeks to file the claim. So by the time claims actually started getting paid, it was in March. Let's say in March you only had, and I'm just guesstimating numbers because I can't see your bank account, $50,000 in there, and $80,000 in claims came in. They would pre-fund the other $30,000 for you so that those claims could get paid timely. They would take the $50,000 you had in there, pay the claims. They would pre-fund the other $30,000 as that part of that overdraft protection that we discussed, and then they would expect you to pay that $30,000 back as you submitted your claims each month.
As your claim's gonna build back
Yeah.
up.
Because your maximum liability is still your maximum liability,
Yeah.
And so they realize that you're not going to pre-fund your entire claims fund up front at the beginning of the year. They know you're going to do it every month, little bit by little, and so it's not your fault if something comes in at the beginning of the month, of the year versus the end of the year. So they have that built in to just protect your bank account.
And just to clarify how they arrive at those numbers, they look at the last 3 years of claims for Van Buren County. So when they underwrite a group, they say over the last three years, what has been the claims that we have seen in this group? Now, there's no way to know what's going to happen from year to year. We know that, right? Like, nobody could have cancer this year, and then we could have 3 employees or members that have it. But those averages over the course, of the last 3 years, regardless of who you've been with, right, is where they get that baseline of what they call your expected claims. Then you have the risk corridor. Y'all have a 25%. Anybody that's self-funded, every group has it. State of Arkansas requires it. You got a 25% cushion that you set to the side, but they fully expect you to be in that expected claims amount, up to that amount. If you exceed it, that cushion that you set to the side, you can go to that and get it. Which at this point, y'all you went through, you had, let's say that your claims this year carried some significant high claims. So we couldn't go back like to Ms. Brown's question earlier, like what numbers might have been an average 2 years ago may not be the same today because you didn't have the same illnesses. Also, just the cost of care, hospitals cost, they charge more this year than they did last year for an MRI or whatever it may be. But just to try to set a baseline of understanding how they arrive at those expected claims is based on that historical, not just last year, but years prior to that.
So back to my question. Are we better off with this company than we were the previous one is really all I am wanting to know. Does anybody have the answer to that?
I think that is a very difficult question to answer because we're having to deal with ambiguities as far as how much would our rate have increased. And with our large claims that we had last year, it would have probably been significant.
And on the
But we
fully
don't.
insured world, because we do have clients on the fully insured world, we were seeing way over double-digit increases. I mean, on a lot of those
Yeah, most
clients.
fully insured clients had an average of 25 to 30%
Yep.
increase at renewal for
So if y'all put
2026.
yourself in that boat, and we don't know, but with your claims, we can expect that's what it would have been.
Oh, yeah, you had
Yeah.
4 claimants over $30,000 apiece.
And to that end, back to, I guess, just for a comparison of that, had you stayed fully insured, you would have seen 25 to 30%, just based on the claims experience, based on the expected and what actually happened. Your renewal was not that high. I will tell you that on the pharmacy program that was implemented, y'all saved between $40,000 and $50,000 on pharmacy claims.
Before the rebates. That didn't include the rebates.
Right, which doesn't even include the rebate, so, which you wouldn't have seen, that on the fully insured side. So the decision that you made to choose to take the self-funded route allowed you to save the money on the pharmacy side of it, allowed you to mitigate some of the claims on the medical side, which instead of a 25 to 30, I think the net ended up being 17 total. But of that 17 total, some of that is being paid to your claims fund. So you're not paying it to an insurance company. Some of it's fixed costs that you have to pay, but some of that 17% you're just putting into your bank account.
You're paying yourself.
So you're paying yourself.
And if you don't use it in claims this year, if you don't have the same claims year that you had last year, and you don't use all it, you don't have maybe 9 high claimants again, which is not usual for a group your size to have that many high claimants. So I don't know what happened last year within your organization, but there was 9 very large claimants. And so I don't expect you to have 9 large claimants every single year. That's not normal. So I would imagine that you would probably have a lot more left in your reserves at the end of this year because of that. Because I would anticipate, hopefully, a better claims year. I do know that one of the large claimants is no longer on the plan. One of the highest large claimants is no longer on the plan, which will definitely benefit and help you guys. And probably also one of the reasons we were able to negotiate a lower increase for you guys for this plan year.
Any further questions?
Lee, do you have any?
Anyone else?
All good questions.
Gentlemen, lady and gentlemen, thank you all for being here.
Well, thank you. And I just wanted, the report that he gave out to you guys is just kind of a snapshot overview of the plan year. And just to, again, reiterate, the reason it starts in March is because claims didn't actually start getting paid until March. There's about a 6 to 8 week time frame for the life cycle of a claim. You go to the doctor, you go to the hospital, and then the insurance biller has to do the paperwork, file it, has to go through the process and then get paid. So that's why you start seeing them paid in March. It's still a full January through December claim shot. Obviously, like she mentioned, there are still going to be claims coming in January that were actually incurred in November or December, right? If you went to the doctor December 26th, they probably didn't get to the insurance company until sometime in January. So you will see some of those run out claims, but the highest impact to your plan last year was outpatient procedures. That's better than inpatient procedures because they cost a lot more, but you did have a significant amount of outpatient procedures, and you had a significant amount of ER usage. Multiple ER usages by a couple of members where they just kept going back to the ER. And so sometimes we get it, an emergency room is there if you're having a life or death emergency. But it would also be very beneficial to try to remind employees to utilize urgent care to go and see their primary care doctor before something gets out of hand and they have to go to an emergency room. And then also the teledoc that you guys have on the plan. Did you hand them that flyer?
Sure.
So you guys have a free teledoc service that employees can utilize. It's 24 hours a day, 7 days a week. If they don't feel like they're dying, if they think they're going to die, they need to call 911 or go to the ER. We'll worry about the cost and the insurance later. But if they're not dying and it's just after hours, we really don't want them utilizing your health plan to go to an ER for something that is a phone call or a doctor's visit. And so maybe just reminding them to use that teledoc feature after hours on the weekends. I use it all the time because I travel for work, and if I don't want to sit in a doctor's office in some random place with a bunch of sick people, so I will call if I get a sinus infection or something, and they'll call my medicine into my nearest Walgreens. You can call. My son had an earache one night in the middle of the night. He was screaming in pain. They called in eardrops to my local 24-hour pharmacist, and I ran and picked it up. So it's a very useful service. It's a whole lot cheaper than an ER visit. And so that is just one of the driving factors that they mentioned last year really could have been preventable within your
I
plan.
get what you're saying, but we don't have a 24-hour pharmacy open around here, nor do we have a walk-in clinic after hours. It's ER or nothing, so.
And if you're, like I said, if it's a life or death emergency, go to the ER. But if it's just, hey, I didn't want to miss work today, or I don't have time to take off work to go to the doctor, I'll just wait until after work and go to the ER, please call telemedicine. You can do that really quickly on your lunch break. It is just like going to a real doctor. You do have to fill out paperwork first because they do need to know your medical background. They need to know if you're allergic to anything. But once you get your profile set up in there, it's real easy to use. So we just want to educate people. We realize that there are reasons to go to an emergency room. But for those that are preventable, and the insurance carrier tells me that there were several last year that were not medical emergencies, we really want to try to push them to utilize the health plan more efficiently.
And if you'll go.
Can you explain this chart just a little bit?
Yes, sir. So if you'll look at this page, on the second page, the first one is just showing you your claims trend at the top. So as Michelle stated, it starts in March, and that's because you started this plan last year. You didn't have people started utilizing it in January, and because of the time it takes for claims to process, you're not actually paying claims that happen in January possibly until March. So that's why you don't see a January and February claims hit until they all kind of have a lag, if you will. So this is 10 months worth of claims, if you will. Just you'll see that they start in March. So you can see in March y'all had a spike in April. That's not out of the ordinary because you actually had
That's
January and
catch up.
February's lag.
Yeah.
Some of it came in March and some of it hit. So it's not like April stands out as something significant. And then May and June, you can see that was pretty close to each other. July and September, you had 2 spikes. So there were some high claimant issues that happened during that time. It's the reason you have health insurance, but that's part of it. So it just shows you the trend on the plan costs by month. Down at the bottom, it's just a cumulative. It's showing you how much was spent in that first month, which is March, going all the way through to the end of October. Okay. You have some averages out to the side.
What's the PEPY, PMPY, PEPM?
So PE is per employee, PM is per member. So per member includes your dependents.
What's PEPY?
Per employee per year. So per employee per year and per member per year. So it just breaks it down by if I took the cost and divided it out by the number of employees on the plan, or if I took the cost and divided it out by the number of actual belly buttons on the plan. Because you do have some people that have like spouse, child, or family cover.
And what are the 2 categories, employee expenditures and employee member cost? Is that their share?
Good question. Yeah. So the first one is the employer contributions, which is 86% of the total cost. And then
well, not contributions, but what the plan pays.
Cost share.
And then the other part is the employee deductibles,
Deduct-
co-pays, out-of-pocket expenses, co-insurance, what the members' costs were.
Your insurance paid $652,000 and the employees paid $102?
Correct.
Correct.
Okay.
And then if you look at the cumulative numbers at the bottom of the page, you'll see a PEPM. It's just monthly. It's just broken down into a monthly number, which it goes, just go to the claims portion of it. You'll see all that is that 652,244 divided by 10 months for that average. And then if you flip over to the next page, this is just some pulling the curtain back, for your plan, if you will. You'll see at the top what the primary drivers of the claim spend of the 652. As Michelle's already stated, outpatient surgery, outpatient services, and you can see in the pie chart to the right, obviously makes up the majority of that. The ER and office visits, which we talked about, having something to be able to allow the employees to have a way to, what are the alternatives of it? In other words, if ER is our only option and there's not an after-hours urgent care, well then they have a teledoc option. And teledoc is different. It takes a little, adjustment for somebody the first time. Michelle don't mind me saying she uses it exclusively. I mean, we literally driving down the road, she feels something going on, and she goes in, sets up an appointment. These doctors have 18 and a half years plus of experience. Your teledocs do. So you're talking to the same, from experience, you're talking to the same doctors, and even more so than you might see in-house at a doctor's office. So they can, if they think it's something that your employee has or a member has that they need to see a doctor's office, they will tell them, you need to go in and see a doctor. But if not, then they can access care directly. They can call that medication into a pharmacy for them and they can go pick it up.
So do the employees benefit long-term if they're using teledoc?
Well, I mean, they're saving time and money by going to a regular doctor, and then
Do they get lower cost the next year? Or?
Well, it definitely helps your plan. I mean, versus an emergency room cost, it definitely helps the plan. And just like any insurance carrier, whether you're fully insured or self-funded, whether you're Blue Cross or United or Aetna, it's your claims versus your premium. You guys have over 50 employees, which means you're not community rated. You're rated based on your claims versus your premiums. And so anything that we can do to try to help mitigate your claims expense helps your plan year over year. And just kind of to go back to your point about, are you better off in this type of product? I believe you are. And the reason for that is because when you were fully insured, you didn't get transparency of data. You didn't know where all your claims dollars were going. There was no way for a broker or a member to look at the claims data and say, this is where we need to steer employees, or this is what we need to steer them away from, or maybe this is something that we could add to the plan that would help them so that they could be healthier. And when you go self-funded, you do get full transparency. You do get very extensive claims reporting. Now, it's not a year-to-year thing. It is a long-term strategy because it takes time for us to build that data, to get that from the insurance carrier. They need to see it not just in, a 10-month snapshot. They need to see it month after month, year after year. So this year, because you were self-funded all year last year, now they know this is how they were last year. I get it's just 1 year of time. 3 years is really the magic number, but once they can see you for a whole year last year, now this year they can look at it and say, well, this is how they're trending this year compared to last year. Are they trending better or worse in pharmacy, in outpatient surgeries, in ER usage? Are we having more hypertensive patients? Are we having more diabetic patients? And then that way we can look at it and say, this is really where we need to focus on communicating and educating employees on their insurance plan. Like maybe we do have too many diabetics on the plan. Maybe we see a growing trend of that. And we need to start reaching out about health coaches or wellness, or maybe we need to contact a local gym and see if they'll offer their employees a discount to come there and get healthier. Maybe we need to, look at doing a health fair so that we can get somebody out there, like a dietitian out there to talk to employees. Or like musculoskeletal. Maybe we have a lot of people having hip replacements or knee replacements or back surgeries. And so maybe we need to send somebody out there to talk to them, or send out resources, talk more about the KISS and how to use it and how to access it, because that does give them access to free health care. And so that's just some of the things that we can utilize the longer you're self-funded and the more data we get in to study and verify on you, to steer you and direct you. When you're fully insured, those curtains are kind of closed. You just get to see what your claims versus premiums are, and you don't get a lot of additional details on that.
Would this teledoc cost the employee when they call? Do they have to?
No.
So it's free? Okay, because I would think going to the ER, the employee's gonna have some sort of bill that the insurance don't cover.
Correct.
So if we
The
can do
employee's going to
this-
have a pretty high copay
Right.
with the emergency room, and then the plan is going to be hit for a lot of money, which hurts your claims versus premiums. Versus the teledoc, the plan's going to be hit for like $24. I mean, I don't know what the exact rate is today versus last year, but it's very, very minimal cost for a teledoc visit versus going to even a regular doctor, but especially an emergency room.
So all the employee would have to pay for is their medication to pick up.
Yes. Now, if they had a medication called in, yes, they would. And that teledoc is going to tell them if they need to go to the emergency room. Like they will look at them and say, hey, you need to stop talking to me and you need to get to the ER or call 911. So if it is something urgent, they will tell them that. But most of the time, most people know if it's something,
And from the medication standpoint, another thing, talking just to speak to Michelle's point, as long as we're fully insured, I know we're repeating it, they're not going to tell you anything. They're just going to tell you what the claims are, and they're not going to tell you what drove it. The medications where you're going to receive rebates, y'all will continue to see rebates. When you're fully insured, that money is paid directly to Blue Cross, UHC, Cignet, and whoever you are. You're now getting that money, and you still have more of that to come in. Your top two medications that hit your plan from a cost standpoint were
Ozempic and Mounjaro.
So that tells you, that there are things that we can address from a pre-diabetic or a diabetic standpoint, maybe lifestyle changes and otherwise. So it gives us knowledge to be able to address it, to come up with something that helps Buren County continue to control costs as much as they can, because the ultimate goal is to keep it affordable and to keep it as rich as possible.
And they have started that campaign. So I knew that. I talked to the pharmacy director the other day. But they have started the campaign of reaching back out to those members to make sure that they're utilizing it correctly. And y'all are not the only ones. Like Ozempic and Mounjaro is the top of every client I've seen this past year's list of medications just about. So that's definitely not specific to Van Buren County by any means.
The Ozempic is not just used for the diabetic anymore. They were using it for weight loss.
Absolutely.
Well, they do use it for weight loss. I realize that, but the doctor would have to certify that they're diabetic.
Yep.
So somebody's telling the insurance carrier that they're diabetic.
Oh, I know several people that were on it for weight loss. So,
Unfortunately, we do too. But I will say this,
Well,
to that extent, I will say this. Sometimes you have to pick and choose where you want to spend your dollars, because if it is working and it is bringing their A1C down and it is helping them lose weight and be healthier, I have also seen a lot of people that have effectively used that to come off of 5 or 6 other medications that they were taking, and to be able to exercise and get out and start walking more, and it did make them healthier overall. Versus having somebody that ends up, in ICU getting their foot amputated because their blood sugar's out of control, or having a heart attack because they can't lose the weight and exercise and become healthier. So sometimes that's one of those love-hate relationships with those medications. But does anybody have any questions?
Shane, Michelle, Tracy, thank you very much for coming.
Thank you.
Thank you.
Like I said, have our phone numbers, let us know. That's what I told them. We don't have a crystal ball, just let us know.
Yes.
Reach out to us. Yes, we're pretty easy to get in touch with. Y'all have a good night.
Thank you.
Thank you very much.
Brings us up to county boards, committees, elected officials, and department heads. Is there anyone that wishes to approach the court? Or court, do you have any questions or comments for any of the department heads or officials that are here? Then we'll move on. The next item on the agenda is the prosecutor's hot check fund.
You want me to make a comment about it? Sure. Oh, this is, every year, y'all probably know, we have to, for transparency purposes, we have to, in all three of our counties, we have to present the hot check report to the quorum court. It's something that legislative audit requires. So it's not county money. These are all fees collected from the hot checks that are filed with the office. But we do have to, for transparency purposes, we do have to publish that to the quorum court. So we do that at the beginning of each year. So that's what that is.
So do we have a copy of that, or is it anything that says a report, or?
Oh, I don't know. You should.
Seen it.
If you don't, we can run it next month
Okay.
with the report.
Was it emailed?
That's just a fund balance.
Yeah, it's just a,
Okay, well, I was just curious.
It may have just been omitted from the packet. Or
yeah, it must have been. Okay, yeah, it should be in there. It's just like, it's a spreadsheet, but we can do it next month. There's no requirement we have to do it in a certain month, just sometime in the
Right.
calendar year.
I remember making it,
Yeah,
I've heard it
yeah.
before, but I just,
Excellent. That's going to move us on to new business, and our first ordinance is sponsored by Mike Bradford.
okay. Be it enacted by the Quorum Court of the County of Van Buren, State of Arkansas, an ordinance to be entitled, an ordinance to transfer monies within the Corps of Engineers budget, number 1000-410, and to approve bonuses for certain deputies to be paid from the Corps budget. Whereas full-time deputies who have been employed by January 1st, 2026 will receive a bonus of $2,500, and a regular part-time deputies will receive $1,000. And whereas this bonus will be paid at one half in April and the second half in August at the first payroll of each month. And whereas monies will need to be transferred from line number 9999 to cover bonuses as stated below. Now therefore be it ordained by the Quorum Court of Van Buren County, Arkansas, that Section 1 bonuses are approved for full-time employees at $2,500 and $1,000 for regular part-time deputies. And Section 2 bonuses will be paid at one half in April and the second half in August at the first payroll of each month. And Section 3 monies will be transferred from number 1000-410-9999, $55,336.50 to number 1000-410-1001. Salaries full-time, $3,689.10 to number 1000-410-1002. Salaries part-time, $3,672 to number 1000-410-1006. Social Security matching, and $7,353.60 to number 1000-410-1008 retirement, totaling $70,051.20. I move we accept this ordinance.
Second.
We have a motion and a second to adopt this ordinance. Any discussion?
I got a question. Eric, is this for fully certified deputies, or is it for the part-time too?
It's part-time because there was two amounts.
Yeah.
The 25 and then the 1,000.
Okay.
Part-time.
And something I want to be read into the record is...
Eric, would you care to come up to the microphone, please?
The one thing that wasn't mentioned, because we keep saying bonuses, I want it to be into the record that it's retention bonuses.
Retention.
Yes, retention. It helps the county with keeping officers. I know we're tapped. We're doing the best we can with 4% raise. Very grateful. Our officers are behind. We stay at that 26 level out of 27 Class 2 counties. As soon as we get our raises, Then they give raises and we're back down to 26. We jumped to 13 at one point, which was great. Felt real good about that. But within, I think it was just a month or two, we found out that everybody else got raises and we bumped right back down. So I just wanted people to understand that it is a retention bonus, and I'm grateful for the Quorum Court and the Budget Committee having given us the 4% raise. It was long overdue, and for all county employees. But we're just working hard at trying to keep our officers because it is a high cost to replace them and train new ones.
Is this moving money around in your budget?
Yes, sir. Money that's already there. We're not asking for more money. We're not asking for more money. It's money in our budget.
This is money from last year.
Yes.
This is not even money from this year. This is money from last year. Because they have you do have an employee still or a deputy for the Corps of Engineers.
Right now, yes, we have a position for that, but that position is empty right now, and we're covering it, and that's why the money continues to bank.
I thought you hired somebody to do that.
We've got a guy hired right now that's going through the academy, but we have one more position to fill now. That's how quick we lose them. So we're back to having to fill another position. And that's the lowest on our pay scale and as far as deputies go. So that's the one that's usually empty. And as soon as we hire someone for that, somebody else leaves and they get bumped up, and that's why it becomes empty again. Yeah. Questions?
The only thing that I had that kind of stuck out to me was the wording of the title. It says the Corps of Engineers budget, which to me is confusing. It's not their budget. It's
a sheriff's office budget. We have 5 budgets, and one of those budgets is the Corps of Engineers, school resource officers, the jail, the sheriff's office, and jail maintenance.
Okay.
So yeah, it's money within our 5 budgets. We're just moving around within our own.
Okay.
Yeah.
It should be fine, I think. Carol, you can comment if you think you need to. It has the fund number, so that should clarify.
Yeah, that's how you want to describe it. Dale, do you agree with that?
I agree.
Yep.
Any further discussion? Roll call vote.
Mays,
Yes.
Sarah,
Yes.
Wellenberger,
Yes.
Bradford,
Yes.
Robertson,
Yes.
Page,
Yes.
Lemmings,
Yes.
Bass.
Yes.
O 2026-03.
Thank you. Our next ordinance is sponsored by Esther Bass.
Be enacted by the Quorum Court of the County of Van Buren, State of Arkansas, an emergency ordinance to be entitled, an emergency ordinance to amend the description of a line item in the various county project budget for 2026, number 1000-804. Whereas line item 1000-804-3101 has been for the Van Buren County Senior Citizen contract for meals and upkeep of the building. And whereas Ozark Health Hospital has since taken over the senior center and will be providing the same. And whereas the description of the line should be changed to Ozark Health Contract, the contract payments will be paid to Ozark Health Hospital. Now therefore be it ordained by the Quorum Court of Van Buren County, Arkansas, that Section 1, the description of line item number 1000-804-3101 be amended to read Ozark Health Contract. Section 2, the contract payments will be paid to Ozark Health Hospital. Section 3, this ordinance be necessary for the protection and preservation of public health and safety. An emergency is hereby declared to exist, and this ordinance shall be enforced and shall take effect upon passage and publication. I move for its adoption.
Second.
We have a motion and a second to adopt this ordinance. Any discussion?
I don't know if it matters, but we have a Section 1, a Section 2, and a Section 2.
I saw that. That is a Scrivener's error. So, unremarkable. Any further discussion?
So how is that going, working with the, transferring it over to the, have you been down to the Senior Citizens Center and see how that food and transfer and all it's going? Good?
It's going very well.
Good. Good deal.
The clients don't really see much of a difference. They're happy.
Is this totally taken over by the hospital? They don't have a manager down there now, or do they?
They do not. If they do, they answer directly to the hospital.
Yeah, okay. I got you. I knew that they were, last year they took the meals over, and they were bringing them from the hospital. This year they're bringing them from the senior center.
Any further discussion? Roll call vote.
Mays,
Yes.
Sarah,
Yes.
Wellenberger,
Yes.
Bradford,
Yes.
Robertson,
Yes.
Page,
Yes.
Lemmings,
Yes.
Bass.
Yes.
O 2026-04.
Thank you. And that had an emergency clause on it, so let's acknowledge that emergency clause. The reason for that clause is so we can get that name changed and get the tax money distributed to Ozark Health upon collection. So it was a time issue. Any further questions about the emergency clause? Motion to accept it?
I'll make that motion.
Second.
Motion and second to acknowledge the emergency clause. Any further discussion? All in favor signify by saying aye. Aye. Any opposed? Thank you. Virgil, you have the next ordinance.
Be enacted by the Quorum Court of the County of Van Buren, the State of Arkansas, an appropriation ordinance to be entitled Appropriation Ordinance to amend the original appropriation ordinance number 2025-47, the annual operating budget for 2026, and to increase revenues and appropriate $1,500 into the Van Buren County Circuit Court Clerk's Office Budget number 1000-102. Whereas during the budget meeting for 2026, it was decided by the committee to appropriate $1,500 into line item 1000-102-3100 for the circuit clerk, and whereas while adding the approved appropriation into the system, this line was missed. Now therefore be it ordained by the Quorum Court of the County of Van Buren, Arkansas, that Section 1, the annual operating budget for 2026 be amended. Section 2, $1,500 be appropriated into the Van Buren County Circuit Clerk Budget number 1000-102-3100, other miscellaneous. I move that we approve as written.
Second.
We have a motion and a couple of seconds to adopt this ordinance. Any discussion?
Now that has been appropriated already, hasn't it? I mean, this is not something new. It just was overlooked. Is that right?
That's what the ordinance states.
Yes. It was approved. It's just
I don't know anything more than what's printed on the ordinance.
I mean, the money's already there. It's been appropriated, correct?
I honestly cannot remember
You're
the
appropriating it right now.
I mean,
Pre-approved
in
is
the
what he's
budget,
asking.
was it put in the budget and it just was overlooked, right?
It was discussed at budget time, and I think when the budget got keyed in, she missed a line.
Okay.
I think that's what happened. We had a human error.
We're human, huh?
We're human. Any further discussion? Roll call vote.
Mays,
Yes.
Sarah,
Yes.
Wellenberger,
Yes.
Bradford,
yes.
Robertson,
Yes.
Page,
Yes.
Lemmings,
Yes.
Bass.
Yes.
O 2026-05.
Thank you. Rabia, it's your turn.
Be it enacted by the Quorum Court of the County of Van Buren, State of Arkansas, an appropriation ordinance to be entitled, an appropriation ordinance to amend the original appropriation ordinance 2025-47, the annual operating budget for 2026 to increase revenues and appropriate $200 into the Van Buren County Juvenile Court Division, to budget 1000-414. Whereas Van Buren County Juvenile Court Division 2 has received a grant through the St. Jude Catholic Church, Clinton, Arkansas, in the amount of $200. And whereas these funds will need to be appropriated into the Juvenile Court Division 2, budget 1000-414. Now therefore be it ordained by the Quorum Court of Van Buren County, Arkansas, that Section 1, the annual operating budget for 2026 be amended. Section 2, $200 be appropriated into the Van Buren County Juvenile Court Division 2. Budget 1000-414-3104. Grant, Girls Book Club donations. I move that this approve it as read.
Second.
We have a motion and a second to adopt this ordinance. Any discussion? Roll call vote.
Mays,
Yes.
Sarah,
Yes.
Wellenberger,
Yes.
Bradford,
Yes.
Robertson,
Yes.
Page,
Yes.
Lemmings,
Yes.
Bass.
Yes.
O 2026-06.
Thank you. Becky, you have the next one.
Being enacted by the Quorum Court of the County of Van Buren, State of Arkansas, an ordinance to be entitled, an ordinance to amend the original ordinance O-2025-47, the annual operating budget for 2026, to change the part-time appropriation fund in number 3008 library from 4 positions to a part-time allocation of the same monetary amount. Whereas there is a need to amend the original appropriation from 4 specific part-time positions to a part-time allocation, and whereas the change does not alter the amount of money appropriated. Now, therefore, be it ordained by the Quorum Court of Van Buren County, Arkansas, that Section 1, Ordinance O 2025-47, the annual operating budget for 2026, is hereby amended to change the 4 part-time positions in the library budget fund, number 3008, to a part-time allocation for the same amount of money. Section 2, 4 positions at $23,400 each shall become 1 part-time allocation of $93,600. I make a motion to approve this. Second.
We have a motion and a second to adopt this ordinance. Any discussion? Roll call vote.
Mays,
Yes.
Sarah,
Yes.
Wellenberger,
Yes.
Bradford,
Yes.
Robertson,
Yes.
Page, Lemmings,
Yes.
Bass.
Yes.
O 2026-07.
Thank you. Next up, we have a resolution. Resolutions are title only unless the sponsor wishes to read it in its entirety. So Bailey, we'll let you choose.
Be it resolved by the Quorum Court of the County of Van Buren, State of Arkansas, a resolution to be entitled, a resolution to confirm the reappointment of a member to the Van Buren County Library Board.
And that member is Catherine Eisenhower. Okay. Do I hear a motion to adopt the resolution?
Second.
We have a motion and a second to adopt the resolution. Any discussion? All in favor of adopting the resolution signify by saying aye.
Aye.
Any opposed?
What number is that?
R 2026-02.
Thank you.
What was the last? Did I use that?
The last ordinance was 07. And our final resolution is yours, Esther, and you have the choice to either read it by title or in its entirety.
No, I'll just read by title. Be it resolved by the Quorum Court of the County of Van Buren, State of Arkansas, a resolution to be entitled, a resolution authorizing the county judge of Van Buren County, Arkansas, to enter into a contract with the Oyler for the Oyler Road Improvement Project. I move for its adoption.
Second.
A motion and a second to adopt this resolution. The contractor will let bids, and those bids came in, and Atlas Asphalt was the bid winner, and we're looking for that project to finally get asphalt laid down somewhere within the 5 to 6 week range, as soon as the plants start making asphalt again and they get kicked back up in production. Any further discussion or questions?
How long, completion date, how long will it take them to do that?
Oh, a couple of days. They're pretty fast.
Good.
We'll have all the prep work done. Any further discussion? All in favor of adopting this resolution signify by saying aye. Aye. Any opposed? I'm sorry, go ahead.
R 2026-03.
Thank you. You voted to dispense with the audible reading of the transfers. There is less than or right around $1,000 worth of transfers from one line item to another. Do I hear a motion to accept the transfers.
So moved.
A motion and a second to approve the transfers. Any discussion? All in favor signify by saying aye. Aye. Any opposed? Have any public comments? Motion to adjourn?
So moved.
Any opposed?